Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing one new case of COVID-19, bringing our total to 204 cases. The total number of deaths related to COVID-19 remains at 2. As of this morning, 11 individuals are hospitalized, and of that, 7 are in intensive care. 17 individuals are listed as recovered. Public health investigations continue to confirm details, and information will be updated on the website as new information is available. Yesterday, 458 tests were performed at Chatham Provincial Lab, bringing the total completed tests to 13,486. As you're aware, Dr. Tam today spoke about the use of masks in public. As more and more cases are reported, worldwide, there's more and more scientific evidence to inform our decision making. As we see more and more transmission going on in the world, although it's clear that the main driver of this pandemic is large respiratory droplets by symptomatic individuals, there's growing evidence that those individuals just before becoming ill, what we call pre-symptomatic stages, may be able to transmit this infection, including some evidence that those who do not develop symptoms, asymptomatic spreading, may also occur. Although we're fairly confident that the major driver beyond this transmission is droplet spread via symptomatic individuals. Because of this, Canadian medical experts now agree that wearing a non-medical mask, even if you have no symptoms, may provide additional protection to others. Certainly the main message of staying home, of ensuring adequate social distancing at all times does not change, and by far is much more important message. But those who wanted to use non-medical masks in public is an additional way to protect those around you by reducing the chances of droplet transmission. So it should be clear that wearing these masks are very unlikely to protect the individual who is wearing the mask. It's more to protect the people around them. But again, the major message is that now is the time to stay home, social distancing at all times, especially in times when that may not be possible. Then wearing a non-medical mask may be a benefit to protect others around that individual. But please do not let this distract from the main message to stay home as much as you can, to follow physical distancing messaging at all times. In addition to that, it's very important to note that medical grade masks should be in the hands of our healthcare providers. So these should not be used in public. Let's save that supply to the hardworking healthcare workers who are at the front line battling this virus. We've been asking Manitobans to take significant precautions against this virus for some time now. The social distancing strategies, the public health orders have been in effect, and can be quite challenging for people to adhere to, but we know it's our best way to interrupt the transmission of this virus. These measures apply to family get-togethers, especially in the holiday season. We know Easter and Passover are coming. These measures are still in place. They apply to these meetings. We should not be having family gatherings at this time. Transmission of this virus can occur in these settings. So meet with family, stay in touch with family through virtual means. But in these upcoming weeks is not the time to have family dinners and get-togethers. Now is the time to stay home, to interrupt the transmission of this virus. We've heard various reports of church services continuing in person, and we know that it's challenging to stay away from events like this for many Manitobans, but it's vital in our attempts to limit the transmission of this virus, to flatten the curve. So everyone needs to adhere to the public health orders, and that includes faith-based organizations. We see reports of growing numbers of people out at the parks, and as we get into spring weather, it's natural to want to get out and enjoy these times. And no doubt we should find ways to stay active, whether that's a walk around the block with our family, but we need to maintain physical distancing at all times. If you're heading to a park and you see many cars there, many people, it's getting crowded, you need to turn back. If you're at the park and many people are coming, it's getting crowded, you need to leave. You need to find a place to walk, to get outdoors, to stay active, but not in large groups of people. We need to interrupt the transmission of this virus. Gathering in large groups is not going to achieve that. We've had some reports of healthcare workers utilizing unproven therapies for coronavirus, for COVID-19. There are currently no proven therapies for COVID-19, so I discourage the use of any unproven methods at this point. Certainly the clinical trials are ongoing, and we need to use evidence-based approaches and science-based ways of proving effective therapies. So do not use therapies that are unproven. Leave that to the clinical trials so we can develop science on this. And certainly there is a COVID-19 research trial going on right now at the U of M. Those who have tested positive for COVID-19, household contacts, or healthcare workers who have been in contact with a proven case can call covid-19research.ca for more information. We know that there are numbers continuing to increase, and we have evidence of early community-based transmission. This is why it's more important now than ever that we stay home. By staying home, you're protecting not only yourself, but the people around you and our communities at large. Not to mention those that are most vulnerable to the severe outcomes of this virus. Those over 65, those with underlying medical conditions, those with immune compromise. We need to protect those individuals. We need to protect our healthcare workers by staying home. We all have this personal responsibility. It's a responsibility, but it's also an opportunity, right? We are not helpless against this virus. We all have that opportunity right now to interrupt the transmission chain. And the best way to do that is to stay home. We have reports of this virus in many parts of Manitoba, but I discourage Manitobans from using specific information to change their behavior, because right now for all Manitobans is the time to stay home, to practice physical distancing at all times. Do not rely on reports. Certainly don't rely on unsupported reports in social media. Acquire your information from credible sources. Manitoba.ca, COVID-19 is a great place to go to. It's updated regularly. These messages of staying home whenever you can, certainly stay home when you're sick. Do not attend your workplace if you're sick. Stay home. If you're ill, you can call Health Links for further advice, but please stay home when you're sick. This includes healthcare workers. I know many healthcare workers are very dedicated, very hardworking, and very used to working through adversity. But now is not the time to attend work, even with mild symptoms. Please, everyone, stay home when you're sick. And to encourage Manitobans to ensure that you're taking care of yourselves in other ways. Those living with medical conditions should continue to be in touch with their healthcare provider, ensure that they're up to date on any assessments that they require. Do not let other medical conditions fall out of hand during these times. Keep in touch with your physician. Many of these visits can be done virtually. So I'll reiterate that we are not helpless against this virus. We have many strategies in place right now designed to flatten the curve, to interrupt the transmission of the virus, but we need all Manitobans to work together, to stay home. If you do have to go out for necessities only, if you can, go out alone. wash your hands frequently, maintain that social distancing at all times. If you choose, you can wear a non-medical grade mask in public, but remember that doesn't really add any benefit to yourself. You're just protecting other people, similar to coughing into your sleeve or sneezing into your sleeve. So once again, I'll thank all Manitobans for stepping up. We've asked a lot, but we know it's for good reason, and together we can interrupt this transmission of this virus. So thank you.
Thanks. Good afternoon. I would like to begin today by thanking Manitobans throughout the province for their support of healthcare workers. We have seen and heard so many wonderful tributes to healthcare professionals, people standing outside their balcony and on their front steps, applauding frontline healthcare providers. And a few days ago, our friends at the Dauphin Fire Department pulled out all their trucks and turned on their sirens for 30 seconds to honor healthcare workers. The Dauphin Fire Chief, Cam Abry, decided more needed to be done to show gratitude for healthcare providers and everyone else working within the public during this pandemic. So he contacted some of his colleagues throughout the Parkland region, and they had a parade in Dauphin with the RCMP and drove past the local health facility, and I understand that was done in other communities throughout the province. So it's a wonderful gesture of support, and it reminds healthcare providers why they do what they do. So it's also significant because other emergency response workers like RCMP, police, and firefighters really understand the sacrifices that healthcare workers are making, and we understand the sacrifices that they make every day. So just to say to our colleagues, firefighters, police, and RCMP, thank you so much for that generous support that was provided, and it's very much appreciated. Thank you. Just a few follow-up from some questions that came up over the weekend at our media hour. One was related to staff parking, and I just wanted to highlight, I did go back and check. So any staff who is relocated to a different site as part of the COVID-19 efforts will be provided with a parking voucher so that they don't have to incur parking at their regular site and another site when that occurs. The other thing is there was questions about the concern about enhanced screening. So when staff come into the facility and have to get screened, there sometimes will be a lineup, and people are worried that they'll be late for the start of their shift. So I do just want to confirm that if you are a little bit late for your shift, you will still be paid for your whole shift. And if someone has to stay a little bit later, they will be paid for that time as well. We have heard that since implementing the screening processes last week, that it is becoming much more expedited and more efficient. And we've had quite overwhelmingly positive responses from staff who feel that this is an effort to keep them safe as well as their patients. So thanks for bearing with us through that change in process. Sometimes it does take time to get it perfected, but lots of work went in by all facilities, so thanks to all. Doctors Manitoba and the Manitoba Healthcare Providers Network are working together to identify where more physicians are required to help for COVID-19. So far, we've had 209 physicians who have signed up to volunteer to help at the screening centers, in emergency departments, and on inpatient units. And as more areas of need are identified, their helping hands will be very much appreciated and deployed wherever we can. This partnership has really been helpful. At the Bison Drive Testing Center, we were able to have 10 physicians come to work there just over this past weekend, so that was really great. And it is helpful, just that team approach. So we have physicians coming back from retirement. We have medical residents as well. So if anyone wants to volunteer who hasn't, you are welcome to go to doctorsmanitoba.ca and sign up. The other thing I wanted to discuss is PPE, personal protective equipment. So we heard from Ontario's Premier that there was concerns about PPE in Ontario, which obviously leads to concerns for Manitobans about the status of our supplies. So I do just want to reiterate that we continue to monitor the supplies on a daily basis to ensure that frontline workers have what they need. It is top of mind, and it is in almost every conversation that we have to protect our healthcare workers, and we are fully committed to doing that. Our logistics experts have been very proactive in coordinating our orders and supply distribution. And I will remind you that before we got into COVID-19, it was pretty standard that we would work with 60 vendors to get everything we needed within the province. We now are working with well over 600 vendors, just trying to manage all the changing tides that are happening. So we're exploring every strategy, though. We are looking at different vendors. We are taking donations from businesses. We are also working with local companies to potentially change the manufacturing so that it's a shift into COVID-19 supplies, which has been fantastic. We're looking at opportunities where we can reuse or reprocess equipment, and we're also continuing on with research on both those issues. So what I can tell you is no stone is going to be left unturned. We are fully committed to this. And it is a rapidly changing environment, though. I'm not going to deny that. And with the border closures and those supply disruptions, every day we have to deal with something differently. So, we do want you to know that you are our top priorities, healthcare providers. We understand the challenge. We are up for the challenge, and we are going to do everything we can to get through this pandemic together. And with that, we will open it up to questions.
Thank you. Just a reminder to our reporters online, a primary question and a follow-up question, and please introduce yourselves. From Global, Marnie.
Good afternoon, Dr. Roussin. Marnie Blunt from Global News. We're hearing from some frustrated property owners who have concerns over tenants not following proper social distancing recommendations. We're hearing everything from parties to large family gatherings to gatherings in common areas of the apartments or condo buildings. And since property owners do not have the jurisdiction to enforce or penalize their tenants over this, would this be something that the province would look at taking enforcement measures over with rental properties?
So we want Manitobans to know that this is serious. We're taking this very seriously. We have public health orders in place that this social distancing, staying home when you can, and when you get into large groups and not following this advice, you're putting yourself and other Manitobans at risk. You're putting our frontline healthcare workers at risk. So this is serious, and we're going to take it seriously, and we're going to continue to escalate our orders as necessary. And we are continuing to find ways to further enforce these orders. So we are looking at ways to try to enforce orders in those circumstances because we need Manitobans to realize that this is serious. This is right now life and death for Manitobans. Need to act now, and we're expecting all Manitobans to follow these orders.
And my follow-up question is just regarding the face masks. We've seen a lot of different opinions on face masks and different stances from public health officials over the past week. What do you say, or how do you respond to concerns from people over public trust with health officials if stances and opinions are differing or changing?
Yeah, so I would say is that our goal here, our strategy here is to always provide Manitobans with the best advice that we can at that time. So our goal isn't to remain consistent. If we need to change our advice based on the evidence, we will. So remaining consistent has never been a goal. It's to be able to provide the best advice on the information we have at that time. And so with the masks here, my biggest issue with the announcement moving forward with it is that I don't want it to become a distraction. The real issue is Manitobans need to stay home. That's the issue. If you have to go out, you need to practice physical distancing at all times. That's a big issue. If you want to choose to wear a non-medical mask out in the public, you may be protecting the people around you, similar to if you always coughed into your sleeve or sneezed into your sleeve. Those masks are unlikely to protect the individual wearing them. So to me, I don't want it to be a distraction. The real issue is stay home, practice physical distancing. If you want to wear one of those masks, there's a growing thought that may help protect people around you, but not the individual wearing them.
Thank you.
From the Winnipeg Free Press, Carol.
Hi there, it's Carol Sanders at the Free Press. I'm just wondering about ICU beds and staffing levels. In January, we heard that there were only enough staff for 58 of a targeted 63 ICU beds in the province. So how many staffed ICU beds are now available?
So the ICU beds still remain 63 funded beds. The occupancy in the beds is actually, we haven't seen it for a long time, but it's kind of been over the last few weeks. It's sitting at about 70% occupancy. So we do have enough nurses to manage the beds that are filled right now. We are graduating more fairly soon. And we are looking at different models of care for when we have to expand beyond 63, beyond our funded beds. So we are looking at what a model of care would look like for that expansion. So conversations are already happening, looking at what kind of training and how we make sure we get the right skill set of professionals taking care of a group of patients in critical care.
My follow-up question is, we're still hearing that it's taking a week for some home care workers to get the PPE they need. April 13th is what one of the unions has told us. What's happening on that front? I'm just wondering if people are worried about home care workers not having enough and spreading the virus from home to home to home.
Yeah, so we developed guidelines, PPE guidelines, that, as you are correct, they will take effect on April 13th. And if people are able to and it works, they can potentially do some of it earlier. I know that logistics said they were working all weekend, making sure that they were filling supplies and sending them. So I think that's happening, and it could take some time to get to the traveling workforce who maybe is on the road and going to different directions, not necessarily located at a specific facility. But we will make every effort to make sure that they do get what they want. And in the meantime, we have made sure that home care providers have screening questions to make sure that the risk is low going in. And I would just remind everyone that washing your hands and keeping a distance when possible, potentially using virtual or phone solutions, those are all options that should be looked at from a home care perspective.
From City News, Stephanie.
Good afternoon, Stephanie Lasuk from City News. You mentioned earlier in that press conference about healthcare workers using unproven methods or therapies or treatments. I just wondered if you could expand on that. Are they using those for themselves, for their patients? What's happening there?
I don't really have specifics on that. I've heard from a number of experts in the field that they've had reports of the utilization of medications that are unproven. And so that's just a message that I wanted to get out, is that we have clinical trials going on. We need to rely on science and evidence-based practice. So I'd strongly discourage the use of unproven therapies. But I do encourage the process of science, such as the studies that I mentioned.
And then just one new case today. What can Manitobans really take from that number?
Nothing really. So we're going to expect some days like this, but I think we're going to expect far fewer days like this going forward. So we get one day with a low count, a couple days here now with a low count. We know that this virus is here. We know we have early community-based transmission. So we are preparing to see increased numbers, but we're doing whatever we can to flatten that curve. So I would discourage Manitobans from taking this value and putting much stock in what it means. We certainly want to see days like this, but we can't rely on this meaning really anything.
Thank you.
From the Canadian Press, Steve.
Oh, hi, it's Steve Lambert from the Canadian Press. Dr. Roussin, you had mentioned that you had seen reports or heard about religious services continuing. Is that something that you heard of happening inside Manitoba, or was that elsewhere? And how widespread do you think that is?
Yeah, the reports that I've had, and certainly not substantiated, but they were in Manitoba and in many regions of Manitoba. And so it's so we understand, these are challenging times, and people are going through challenges. So events like that bring support to people. So we fully understand this, but we just want to get that message out to Manitobans that this is important. This virus is here. It's out in the community, and gatherings like that are we know in other jurisdictions a lot of transmission has occurred in faith-based gatherings, and so. This is important. Those public health orders apply to faith-based gatherings, and we expect all Manitobans to adhere to these, because it's again, you're not only putting yourself at risk, you're putting all Manitobans at risk when you attend venues like this.
And my follow-up question is on the enforcement that you mentioned, maybe looking at other types of enforcement. In Nova Scotia, in Halifax, they've closed completely all municipal parks, including the parking lots, and they've been handing out dozens of fines, starting at about $700 per person for people who violate public health orders. Most of those are going into areas that are now off limits. Is that something you would like to see in Manitoba?
Yeah, so nothing's off the table here. So this is important. This is vital right now, especially in these next number of weeks, that we flatten this curve. And the best way to do this is social distancing. And so we have orders in place. We expect all Manitobans to follow them. And you know what? Most are. Most are. And we thank Manitobans. We know it's a difficult time. But this is important, so we're going to look at any way that we can try to enforce it to make sure people understand how important this is, that it's not only affecting you, it's affecting all Manitobans. Really, it's quite literally about saving Manitobans' lives, and so we're going to take it seriously.
Thank you.
From CTV Winnipeg, Michelle.
Hi, it's Michelle Gerwin from CTV Winnipeg. Just a question about if somebody chooses to wear a non-medical mask, what is the best way to put one on and take one off so that you're not exposing yourself to whatever may be on the surface of the mask?
That's right. So these should be cleaned frequently. When you taking them off is important. So to be careful not to touch your mouth or your eyes or your face when you're taking it off, and then wash your hands immediately and the mask. So I think there might be some advice that will come out at the online about the best way to maybe use these. But again, I don't want it to distract from the most important message that is to stay home. If you were staying home before, you should stay home now still. Don't go out now because somebody has said that we can use cloth or non-medical masks. So they do serve a purpose. They can protect people around you. It's analogous to coughing into your sleeve. So they probably can benefit the people around you. But again, there shouldn't be many people around you because we're physically distancing. So that's the big message.
Okay, thank you. And then as a follow-up, do you know anything about Manitoba diverting PPE to other provinces as some sort of sharing efforts? Or the Premier was asked about this, but he told us to ask you. So what do you know about that?
Well, I would say that the orders that we are placing, we're doing some provincially, but there's some that's also going through the federal government. And so I know they're struggling as well, just making sure that the distribution and supply chain is maintained. So yeah, so as far as I know, our orders are still flowing to us. No one's told me specifically that there's been donations from Manitoba going elsewhere, but it is really about looking at where's the greatest need right now for all Canadians. So we know other provinces are struggling. So I think right now, all orders should be coming in the coming weeks. So we're going to just keep on that track. And if anything changes, we'll be sure to let you know.
Thank you.
From the CDC Manitoba, Bartley.
Bartley, the CDC. Ms. Siragusa, how many healthcare workers right now have tested positive and how many are self-isolating total throughout the province?
So we have been looking at our numbers. I have some unofficial, but we are verifying between our occupational health group and our public health information system. So we were planning on providing a weekly update for you on what that looks like, unless there's any situation that involves a risk to public safety. So we will provide you with that. But I can tell you, as of today, there was no more infected healthcare workers today than there was yesterday, unofficially. And I have not been tracking. We can look if we can find those isolating. That's a moving number all the time. It'd be hard to keep that current for you, but we can see what we can find, Bartley.
Okay, thanks. Hopefully that would be in the, you could guesstimate that to some degree. Other question here. We've been told of a couple of examples, Dr. Roussin, where people have been given information that they have false negatives. Now, knowing what we know about polymerase chain reaction testing, false positives are possible. False negatives don't really make sense. What do healthcare workers mean when they are telling people who've received tests that they've had a false negative? It's happened at least twice that we've been told.
So if a false negative is exactly that you received a negative result when it was actually positive. And so this is possible in any test, including PCR. And so in the literature, where we see this is people who have no symptoms can test negative and later test positive. And so we might determine that as a false negative. We know that in certain cases, in those that are critically ill, the nasopharyngeal swab has come back negative when a much lower respiratory sample has come back positive. So we could classify that as a false negative as well. So I don't know the specifics in those scenarios, but those are the type of things, and that's more about the sampling technique sometimes can give you a false negative. But those are the situations we'd say.
Concerned that there's a lot of false negatives out there?
No, we would say so we would, determine that our term for that is sensitivity. And so the sensitivity of this test in those that are symptomatic is in the 90s, higher than 90%. And so certainly those at high risk, so those say in critical care that were suspicious for it, if their test was negative, then we might retest it. If they had certain CT findings and their test was negative, we might try to find a lower respiratory sample for that. So for the most part, symptomatic people in the community, sensitivity is really good.
Thanks.
From CBC Radio Canada, Mohammed.
Hello, Dr. Roussin and Lanette Siragusa. I have a quite specific question on intensive care beds. How many intensive care beds do we have in the province in normal time, where we're not in pandemic situation? And how many of these intensive care beds do we have during the crisis? Thank you.
So the medicine beds, I'm trying to think provincially. We can get those numbers for you. And there's different levels of acuity in those medicine beds. So some are more transitional, low acute medicine beds waiting to go somewhere else. Some are more higher acute and more intense, and usually those are the ones connected with the intensive care unit. So for the intensive care beds, we have around 87, and we have the potential right now to go up higher than that depending on the needs of COVID-19. But it's really based on multiple factors, including supply, equipment, and staff, and space. But we're looking pretty good on most fronts that we should be able to increase those numbers. We still have to get the staffing trained up, but depending on the model and the recruitment, we should be able to report on some numbers with more certainty in the future.
Thank you very much.
From the Winnipeg Sun, Josh.
Hi, good afternoon. This is Josh Aldridge with Winnipeg Sun. Just looking at the number of tests completed by Chatham Laboratories over the last number of days, it seems that the numbers completed have been dropping kind of consistently there. Has the lab hit a capacity point, or are there issues in getting more tests completed, or have we just run through the backlog at this point?
There's a little bit of, it's the backlog has been run through for sure. Some of the test numbers that it requires a certain staffing and certain procedures to get up at that over that 1,000 range. So certainly over the weekend, the lab isn't always running at that capacity. So we'll see again this week. We'll start seeing those numbers increase again throughout the week. But it really is a technical issue at the lab that's very difficult to run 7 days a week. So on average, you'll see our numbers increasing, but you might find certain days where the numbers are a little bit lower than other times.
All right. And just looking at what's gone on over the last weekend or so with all the precipitation that we've had, kind of increases the possibility for flooding or bigger flooding. What are the plans provincially when it comes to making sure people are socially distancing? If they're evacuated from their homes, where they're going to be sent? Are we looking at getting into more hotels at this point being set up through the province, or more communities? What are the measures in place to ensure that there are the proper protocols being followed when it comes to social distancing, or even just preparing for the flood through sandbags, those types of things? What's being put in place?
Efforts continue to make sure that we find available spaces throughout Manitoba, both for COVID-19 and in the event of flooding. So there's quite a few options. We have our capital planning people going to visit different sites to look at the requirements from a COVID-19. There's obviously infection prevention and control requirements, slightly different than if you're evacuating a flood group. But we have a lot of experienced people in our emergency operations, and they've certainly done the floods quite a few times, so they know the drill and can put that into motion. It's just a matter of putting that into motion at the same time as COVID-19. There'll be lots of people making extra efforts, but it's ongoing work. It's part of our preparedness planning.
From CJOB, Diana.
Good afternoon, Diana Foxall from 680 CJOB. Dr. Roussin, I asked the Premier earlier, but we're hearing that Western Surgery Centre, which is currently closed, has been offered a shared house to handle some non-COVID cases right now and could actually handle patients staying there overnight if the government were to instruct the College of Physicians and Surgeons to allow it to do so. Why isn't this being done, or why hasn't this been done, and is that something that you are looking at?
So we are having ongoing conversations with Western Surgical Centre about the role that they could play. So more will follow with that.
Okay, and then as a follow-up, kind of as mentioned earlier, less than 350 tests were done yesterday. Are we seeing sort of fewer people in those populations that fit the criteria coming in for testing, and does that mean that it might be time to expand testing to more people?
Yeah, well, we are looking at expanding our testing. It was 458 tests done yesterday, and so yes, we continually look at our testing criteria, who we want to be testing, and looking at ways to expand that and also to sustain it. So we have to be careful that we don't open testing up too much and then miss the ability to test those at high risk. But we are right now testing all those that are symptomatic return travelers, contacts to cases or suspected cases, all symptomatic healthcare workers regardless of travel, those symptomatic within hospitals that are regardless of their travel. We're testing all people with symptoms in the North or in First Nations regardless of their travel. So we have opened up the testing quite a bit, and we'll continue to assess that over time.
Thank you. Apologies, I misheard the figure.
From the Brandon Sun, Drew.
Thank you. This is Drew May from the Brandon Sun. Ms. Siragusa, last week you made the announcement that healthcare workers will be wearing personal protective equipment while seeing patients. But when does Shared Health actually expect all the workers to actually get the masks and gloves and whatnot and be able to use them?
So shipments are going out immediately, and it's a matter of getting the orders and logistics packaging it up and getting it to the regions. The regions have to get it to the workers. So it's happening now as we speak, and our goal is to make sure by April 13th that everyone has their PPE in their hands. So it'll be a process over time.
Okay, thank you.
Thanks.
From the Thompson Citizen, Ian.
Hi, this is Ian from the Thompson Citizen. I'm just wondering, last week the Premier announced that province is seeking proposals for, low acuity hospitals if needed in Winnipeg, Brandon, and Thompson. I'm just wondering, what would be the trigger for Thompson to have that facility open?
Well, I think it will depend on what the needs of that population is who would be using that space. So if our intention actually is to keep supplies, equipment, and staff where they need to be for the sick patient that requires hospitalization. So for non-acute type patients, that may be patients who typically could go home, but maybe the home environment's not ready for them, or maybe they need home care, but the services are limited because of the situation we're in. So that would be really a place to sort of transition back home to the community. And so I guess it would depend on the level of service that is required and the volume of patients coming through the system, so that we can make sure everyone has a safe place to land, depending on their acuity needs. So right now, we're looking okay. We have space, we have staff. As numbers go up, we'll have to see. I can't really predict how fast that's going to happen and exactly when, but we will be monitoring every day and we're planning in advance, and we will make decisions as we need to expand space.
Okay, and as a follow-up, even the hospital here in Thompson a lot of times relies on workers coming from outside to staff normal operations. I was just wondering if more healthcare workers, are unable to go to work because of, possible symptoms of COVID-19. Do you think, is there going to be difficulty to maintain staffing levels up here if, out-of-town workers can't make the trip up?
I think that's always a risk that we're going to have to deal with for sure, and especially like you said, when you're relying on out-of-province workers to come in. So yes, I would say it could be a problem. What we're looking at is making sure that we can support the sites to maintain operations. So that may mean looking at different staffing models, which we don't usually do in normal times, but these are not normal times. So there's work going on to look at what would that be. And then also really being able to support virtually. So I know in Winnipeg, a lot of the ambulatory clinics have decreased. About 80% of them are not seeing people in person anymore. They're seeing them virtually. And they're offering virtual support to their colleagues in rural and northern Manitoba. So if they need an internal medicine consult, there is a way to access a specialist, and it may be virtually, but it's still expert advice and support, and if a transfer is required, we will make it happen.
Thank you. We have time for a few more questions, if any of our
Dr. Roussin, here at CBC. Can you please give me your opinion on whether or not city dwellers can go to their cabins or to provincial parks or national parks, whether it's safe or advisable for them to do so if they intend to not interact with any locals, any local businesses, anyone else? Just go there, come back. What is your opinion on that?
Well, I mean, my opinion is, and you probably know what my answer is, it's stay home. That's my recommendation to everyone right now. Stay home. So now, if that's the sort of the black and white answer is to stay home. So if you were to go just with your family, not a collection of families, just to the cabin, didn't interact in any other way and come back, well, we're dealing with a lower risk situation there. But again, the overall messaging is to stay home. It's a challenging time right now for Manitobans, but if we all do our part, if we all focus on staying home, we're going to dramatically interrupt the transmission of this virus. And so that would be my advice.
Dr. Roussin, it's Steve Lambert from the Canadian Press. I'm wondering if you've had any conversations with municipalities and whether you would have any advice on whether they should close parks altogether. In some cases, they close structures within the parks and aspects of the parks, the facilities, but the parks themselves, in many cases, are still open.
So we have interacted with the municipalities. Parks are not an easy decision because there's a lot of unintended consequences to closing them. We might find people in other places that are more crowded then. So we're always looking at that, and we're looking at how people respond. We see some evidence of crowding in parks, so we're looking at that, whether we can better enforce that. And so that's certainly on the table. And so all these things we continue to look at. And you know, it's getting nice out there. It's always a tough winter in Manitoba, and so the nicer weather makes people want to get out and be active, and they should try to be active and stay healthy. But really, it's the focus has got to be stay at home. If you did want to take in a park, you know, you gotta be absolutely sure you can maintain that physical distancing. If you're not, you got to turn around and find someplace else.
Josh Aldridge, Winnipeg Sun, just looking for clarification on a couple of things. Number one, you talked a little bit about healthcare workers getting a voucher if they have to move places. What about those staying in place? Are they currently getting free parking? The other question I have is how many people have come out of retirement or come back early to help out and volunteer when it comes to the request that went out earlier for more nurses to come back into service?
I'm sorry, Josh, what was the first question? Who you were asking about who
Sure.
gets free parking?
Yeah, so just real quick, those moving places are getting a free voucher, but those staying in place, they're still getting that free parking and all the rest?
Well, if they pay for parking normally at a site, then they'll still pay for their parking. It's only if they have to travel to a different site that they would get a voucher. So they're not paying double parking, if that makes sense.
It does.
Okay.
And for the second part of that, how many nurses or other healthcare professionals that the request went out previously to come back into service to help out? Do you have numbers on how many have come back to lend a hand to the frontline workers or join the front line?
You know what? I just asked that question this morning. They've been coming in pretty steadily, I'm excited to say. So I will get you a number once I get it reported out. I just asked about 10 o'clock today. So I can get you very accurate numbers as soon as we're done here.
Sounds great. Thank you.
Okay.
Michelle from CTV. Lanette, you said that you wanted to have everyone with PPE in their hands by April 13th. So who do you mean by everyone? Can you just elaborate on that?
For sure, our healthcare workers. There's others who also need PPE. And I understand government is working with families and justice. So ideally, we're all working together to get our PPE supply. But for the healthcare workers specifically who are walking into those situations, that is our goal within the health system.
Hi. It's
Any other question?
I have a question. It's Carol at the Free Press. I just want to know, where are the COVID-19 patients who are in ICU now? Are they all at the HSC, and has the 30-bed unit opened up for COVID-19 patients there?
The ICU patients are currently at Health Science Centre and St. Bede, and then the 30-bed unit. I'm not sure if Lanette, do you know if they've?
I do not think it's been opened yet.
Okay.
Yeah. I'll verify that.
Dr. Roussin, it's Bartha here again. On March 23rd, you said you were reaching out to municipalities and agencies to see how enforcement could be expanded beyond inspectors. How are those discussions going?
Yeah, and so I think that there's a lot of the municipalities are reaching out and asking how they can assist with this. And so we even today we're meeting later to further see how we can enhance the enforcement of these orders, because we want Manitobans to know we're taking this very seriously, and they should too.
And Dr. Roussin, it's Steve Lambert from the Canadian Press. Has there been any discussion of using conservation officers or other provincial agents to help out, public health officers or whoever else might be enforcing these things?
There's been a lot of a review of who can be brought in to help enforce this. and so it's could include a number of different provincial employees, but we're still looking at those options.
Josh Aldridge, Winnipeg Sun. I know the last couple of weeks there's been a lot of talk about modeling and trying to predict how bad this is going to get in Manitoba comparing to other jurisdictions and going off of some of their modeling. Last week we were talking about we'll have a better idea this week. Are we any closer to those kind of predictions and those types of models at this point?
Yes, we factors. It's my advice would be just to stay home. If people with symptoms attend in a First Nations community or in the north, they will be eligible for testing for COVID-19.
Why was that changed from before?
It's just it wasn't much of a change because we had it as the First Nations were considered remote, and so we had that as one of our prioritized samples, so including the people in congregate settings like in prisons. We included remote settings, and so it's just a bit of an expansion on that.
Michelle from CTV, wondering what the effects the social distancing measures have had on the flu season.
Yeah, it's a good question. We've seen, decreasing utilization in beds and ICU beds during this time. It's hard to know what that relates to, if it relates to social distancing at all, but certain these type of strategies, a lot of the strategies we put in place, certainly the basic ones, washing your hands, staying home when you're sick, are effective against any type of respiratory virus. So it's hard to say what effect it's had because we're typically on the downswing now of flu season anyways, but it's a good thought that some of these measures are universal. They can protect us against a number of illnesses.
All right, thank you. We have time for one more question.
Dr. Roussin, it's Steve Lambert from the Canadian Press again. There was a media report out of Quebec this morning that said Manitoba has offered to send masks and other personal protective equipment to Ontario and Quebec because their numbers ramped up earlier and have ramped up much higher to date. Is that true? Has Manitoba offered to send equipment to Ontario or Quebec?
I have not heard that.
There are ongoing conversations with the provincial and federal logistics groups to monitor supply and coordinate distribution. So I haven't heard that either, but there are ongoing conversations happening.
Thank you, everyone. That concludes today's media briefing.